Diabetes and hypertension are complex diseases that require lifelong management. Many patients struggle with medication adherence, lifestyle challenges, and the emotional toll of living with this health challenge. According to WHO, about 422 million people worldwide have diabetes, the majority living in low and middle-income countries, and 1.5 million deaths are directly attributed to diabetes each year, while an estimated 1.28 billion adults aged 30 to 79 years worldwide have hypertension, most, approximately two-thirds, living in low and middle-income countries. In this documentary, we explore a transformative project designed to make a real difference in the lives of those living with these conditions.
Diane is digitizing for impact, improving access to intermediate services or for NCD in Nigeria. It was EHA's board idea to promote innovation and creativity around solving public health problems. The overall goal of the project is to increase access to the treatments, the services of non-communicable diseases. People getting to be screened and then being enrolled and treated for NCDs. And then our focus on this project is hypertension and diabetes, which also mirrors how PEN was piloted, in Nigeria.
PEN intervention is very unique. It's like a metamorphosis type or an hybrid of WHO PEN. WHO PEN means World Health Organization Packaged Essential Non-Communicable Diseases Intervention. But Nigerian PEN narrowed it down. So we now use only hypertension and diabetes under NPEN because primary health care has been identified as the most viable ways of reducing the burdens of NCDs, particularly the cardiovascular diseases.
Non-communicable disease is the leading cause of death, not just in Nigeria, but globally. So those numbers are what inspired my team to scout more into what problem, what solution, how do we solve this public health problem. So that's how we came about the Diane project. One of WHO's reports, he stated that if more people get to know their status, know their numbers in terms of hypertension, diabetes, and on all the NCDs, over 76 million deaths will be averted. So we thought to contribute to that, make people get to know their numbers, check people's blood pressure, blood glucose, and then, be able to know where they are and then take care of themselves to avert, these deaths.
Before now, I have a minimal knowledge of hypertensive and diabetic and these NCD issues, disease condition. But with the coming of this intervention, I have been trained for the knowledge of hypertensive, in and out of it, the complication, the signs and symptoms, and other, and even the drugs, side effects or the adverse effects. I'm perfectly equipped.
We acquire so many knowledge that we are able to put them, that is this key in practice, that's like checking of BP and also knowing the complication with all of this and how to communicate with our patient, like giving that rapport before approaching patients. So after the training and the initiation of this NCD, it goes a long way because there was more confidence in the both side, both the health, like we and the patients.
The current challenges faced by patients with diabetes and hypertension is adherence to medications. We've had a few patients where we'd have to keep following up counseling and, encouraging them to take their medications. Also, getting the patients to carry us along. Sometimes we visit them at home while they're not there.
With the Diane project, I had more knowledge on how to manage my hypertensive and diabetic patients because I do visit my patients at home, making sure that their BP is stable, making sure that they are adhering to their medications, and also I make sure that they are on lifestyle modification.
There is one woman that is living here in our neighborhood. She even didn't know that she is severely hypertensive until when we called for this outreach. And when her blood pressure was monitored, it was like around 190/100 without her not knowing. So immediately when we enroll her to the project, her blood pressure has been controlled now. She is now reading 120/86. And this woman, to her surprise, she cannot even afford to go to the hospital, talk less of buying medication. But with this intervention, she is able to take drugs free of charge. She is a widow. Even if at times she is sick, the children used to buy Panadol for her from chemists. And it's this hypertension that's giving her headache. They will buy Panadol for her. But this intervention has helped her a lot. Her blood pressure is being controlled. She is okay.
Gudunmawa kam gaskiya na ji daɗin sa gudunmawan nan. Magani yana taimaka mana sosai. Har ina gaya wa ‘yan uwana ma akwai tallafin da ake yi ga matan tana anguwanmu. Ina zuwa gidanta tun da farko da na fara ciwo ɗin dama asibitin da ke zuwa. Da na ji labari tana ba da tallafi kuma sai na je gidanta take min tallafin nan haka. Kuma magani kyauta za a yi gwajin kyauta. Sai na gaggaya wa ‘yan uwana haka. An samu ci gaba gaskiya saboda da dai ba na samun barci, yanzu ina samun barci, ciwon kai ma da sauki ba na jin ta kamar na da. Jima kan lafiya da na ji daɗin sa haka gaskiya baya yi min kamar na da. Na gode kuma da tallafin da kuke taimaka mana da shi.
To, na suga dai ban san da shi ba, amma ina da na hawan jini shekara 7 kenan. Gaskiya ta taimake ni sosai, Allah saka da haira. Dan zuwanta ya man alheri sosai, na ji ƙarfin jikina kuma na fahimta da tana zuwa akai-akai tana bani magani. Fiye da daɗin nan ina aiki na ina jin ƙarfin jikina.
Initially her blood pressure was 180/110. I visited her several times. She said she don't have money to start medications. But with these free medications, her blood pressure came down and she do complain of blurry vision, dizziness, headache, constant headache. But all of that is gone now and she's perfectly okay now.
At least my BP is normal now. From 190, 220, 230 is now 120.
With the intervention of this, sometimes I'll just see her coming, Mama, take drugs, so for free. I will be very happy. So anytime I see her, I will feel joy. Now like this, I can wash anything that has to do with hard work. Now I can do it. There's no any symptom as in that dizziness, headache, nothing. I'm healthy and I'm good.
You don't play with your health. The drugs is very important. Like somebody like me, I take my drugs 6 a.m. in the morning so that I will not forget to take my drugs. And also check your BP constantly. It will help you a lot.
It's not like before that I go to, if I don't have money, I will wait before I will get money to go and buy drugs. But now I get my drugs always.
Initially, it wasn't that easy because it was hard gaining their consent, like their confidence in trusting you, the medications and all of that.
And especially something that is coming free. You know, people have this kind of perception that it may not be a quality or the efficacy may not be there.
But as time goes on with frequent visitation, the job became easier.
Unlike before that, if you are passing, maybe you will greet first, but now they will be the one to greet you first. We have a lot of respect from them.
I can tell you made a lot of impact. So now we've screened over 500 people, close to 300 people were enrolled on this treatment. For hypertension, we'll have like 69% control rate, which is high. And then for diabetes, we have recorded like about 60% control rate. So I'm happy that, we made that much impact on this project.
I would like to appreciate the organization that initiated this because a lot of resources has been put in place. So we appreciate that. If they can be able to extend this program, even if possible, you can make it to be a permanent program we can run within eHealth, because so many of them, after the program, they were telling their relative, this clinic is good, they give free medication. So many others were coming, expecting to get free medication.
Like those who were unable to afford those medications before, if this program ends, the blood pressure is going to shoot up because they don't have money to continue taking the medications. And since hypertensive and diabetic medications are long-term medications, so that the BP will not shoot up and those complications that we've tried to manage won't set in again.
I am looking forward to when NCD will be funded like HIV programs. I'm looking forward to when we'll have free treatments for NCDs. And that's where I think we should go to. Because if the essence is to avert death and promote good health and livelihood, then we need to get to that point, especially in these low-income countries.
Through innovation, dedication, and collaboration, this project is making strides in improving the lives of those with diabetes and hypertension. As we continue to support and empower patients, we move closer to a future where chronic conditions are managed effectively and every individual has the opportunity to live a healthier, more fulfilling life. Join us in our mission to transform healthcare for those living with chronic conditions. Together, we can make a difference.